Good day. Today we're going to talk about a topic that's often whispered about, ignored, or even treated as taboo, yet it remains a fundamental part of human well-being at every stage of life: sex in older age. Many assume that once you hit your 60s or 70s, intimacy fades into the background. But the reality? Millions of adults over 50, 60, 70, even 80 continue to enjoy fulfilling sexual relationships. And for those who don't, often it's not because they've lost desire, but because they lack information, support, or open dialogue. So let's set the record straight with science, compassion, and practical insight. Part 1. Is sex still normal and healthy after 50? Absolutely yes. Research from institutions like the University of Michigan and the National Social Life, Health, and Aging Project shows that nearly 60% of adults aged 57 to 85 remain sexually active, and a significant portion report satisfaction with their intimate lives. Why does it matter? Because sexual activity in later life is linked to lower stress and better mood thanks to oxytocin and endorphins, improved cardiovascular health, stronger immune function, deeper emotional bonding with a partner, and even longer life expectancy. Studies suggest regular intimacy correlates with reduced mortality risk. Sex isn't just about pleasure, it's a vital sign of overall health, both physical and emotional. Part 2. The challenges. What changes with age? Now, let's be realistic. Aging does bring physiological changes that affect intimacy for both men and women. In men, testosterone levels gradually decline, about 1% per year after 30. Erections may take longer to achieve, be less firm, or require more direct stimulation. Recovery time between orgasms increases. Some men experience erectile dysfunction, ED, affecting up to 50% of men over 60, but ED is often treatable, not inevitable. In women, menopause, typically between 45 and 55, leads to a sharp drop in estrogen. This can cause vaginal dryness, thinning of vaginal walls, a condition called genitourinary syndrome of menopause, and reduced natural lubrication. These changes may lead to discomfort or pain during intercourse, not lack of desire. Libido may shift, but many women report increased sexual satisfaction post-menopause due to freedom from pregnancy concerns and greater self-confidence. For both, chronic conditions like diabetes, heart disease, arthritis can affect energy, mobility, or sensation. Medications like blood pressure drugs, antidepressants, or prostate treatments may reduce arousal or delay orgasm. Psychological factors, grief, loneliness, body image concerns, or fear of performance can be just as impactful as physical ones. But here's the key. These aren't dead ends, they're signals to adapt. Part 3. The benefits. Why it's worth the effort. Let's highlight what many overlook. Emotional intimacy deepens. Older couples often report that sex becomes less about performance and more about connection, touch, closeness, presence. This emotional resonance can be more fulfilling than youthful passion. Improved sleep and reduced pain. Orgasm triggers the release of prolactin and oxytocin, which promote relaxation and sleep, critical for older adults who often struggle with insomnia. Physical touch also raises pain thresholds. Pelvic floor health. Regular sexual activity helps maintain blood flow and muscle tone in the pelvic region, reducing the risk of urinary incontinence and supporting vaginal and penile health. Cognitive stimulation. Intimacy engages memory, emotion, and sensory processing, keeping the brain active and connected. Relationship resilience. Couples who maintain physical closeness during aging often navigate life transitions, retirement, illness, loss, with greater unity. Part 4. How to make it work. Practical, science-backed advice. For women, address dryness proactively. Use water-based or silicone-based lubricants before discomfort starts, not as a last resort. For persistent dryness, vaginal moisturizers used 2 to 3 times per week or low-dose vaginal estrogen, creams, rings, or tablets can restore tissue health. Safe even for breast cancer survivors in many cases. Consult your doctor. Pelvic floor exercises, Kegels, improve sensation and reduce incontinence. For men, ED is manageable. First, rule out underlying causes, heart disease, diabetes, low testosterone. FDA-approved medications like sildenafil, Viagra, or tadalafil, Cialis, when used correctly, are safe for most older men, but never mix with nitrates for heart conditions. Vacuum erection devices or penile implants are options when pills don't work. Remember, erection does not equal arousal. Many men enjoy intimacy through touch, oral sex, or mutual massage, even without full erection. For couples, redefine sex. Intercourse is just one form of intimacy. Sensual touch, massage, cuddling, mutual masturbation, oral sex, these all count. Communication is essential. What feels good now? What would you like to try? Schedule intimacy if needed. Spontaneity declines with age, but planned closeness can be just as meaningful. Position and comfort matter. Arthritis or back pain? Use pillows for support. Try side-by-side positions, spooning, or seated positions. Take your time. Foreplay isn't optional, it's necessary for arousal and lubrication. Mental and emotional health. Address anxiety or shame. Many older adults feel too old for sex, but desire doesn't expire. If grieving or lonely, consider counseling. A therapist specializing in aging or sexuality can help. Part 5. What to avoid. Don't assume it's over. Desire may change, but rarely vanishes completely. Don't self-medicate with supplements. Many male enhancement pills are unregulated and dangerous. Don't ignore pain. Pain during sex is not normal. It's a medical signal. And don't neglect STI protection. STI rates are rising sharply among adults over 50. Condoms still matter, especially with new partners. Part 6. Solo sex. Often overlooked, always valid. Masturbation remains safe, healthy, and beneficial at any age. It relieves stress, improves sleep, maintains genital blood flow, and helps you understand your changing body. There's no age limit on self-pleasure and no shame in it. Final thought. Sexuality is lifelong. Aging doesn't erase your right to pleasure, closeness, or bodily autonomy. In fact, many report that sex in later life is more authentic, less pressured, and deeply satisfying, precisely because it's no longer about performance, but presence. The goal isn't to replicate your 20s, it's to adapt with wisdom, care, and openness. So talk to your doctor, talk to your partner, be patient with your body, and remember, intimacy isn't about how old you are, it's about how alive you feel. Thank you.